Good morning. Welcome back to Daybreak on this 30th day of March 2021. It's now 16 minutes to 7 o'clock. My name is Sam Gituku, and it's time we want to have a discussion on what's informing conversations across the country. And I want to introduce the panel, starting with Dr. Chris Omalo, the Member of Parliament for Kenyattas constituency. Karibu sana to the show.
Asante sana.
He is also the Acting Secretary General for Ford Kenya, though sometimes disputed. We have Edwin Sifuna, Secretary General of the ODM Party. Karibu sana to the show.
Asante.
And Honorable Sabina Chege, the woman representative for Murang'a County. She's also the chairperson of the Health Committee at the National Assembly. Karibu sana.
Asante.
And joining us via way of Skype is Caleb Kositanyi. He is the Member of Parliament for Soy constituency. Good morning, Mheshimiwa.
Morning, Sam, and all the other panelists.
Great, and I want us to begin the conversation by looking at what is in the two dailies. On the front page of the Daily Nation, you'll see the story of the passing on of Mamasara Obama. Died yesterday at 4:45 a.m. at the age of 99, and she has been mourned by many, including her famous grandson, former President Barack Obama. Then similar story on the front page of the Standard, heartbreak for Obama's grandma to the world. Tributes pour in for Mamasara Obama, who burst into stardom when her grandson Barack Obama was elected U.S. President in 2009. The Obamas are grief-stricken but are also celebrating a graceful woman who Obama described as his bridge to the past. And I want us to begin at that point by paying tribute to Mamasara Obama, who we understand will be buried this morning at her home in Kogelo in Siaya County. Once that process begins, to be sure to take you there. But Honorable Sabina Chege, how will you remember Mamasara Obama? Of course, at the age of 99, and many saying that she had quite an impact on matters of education and taking care of the vulnerable in the society.
First and foremost, let me just also give my sincere condolences to the family, the Obama family. And as you said, she was at the age of 99, so we celebrate her life. That is not a mean achievement of living that long. But secondly, also that she lived a meaningful life. And I would say in her impact, not just because she's known or associated with the former President of the United States, but she's a lady who also embraced others in her community, lived with them. And I'm sure if it was maybe some, when Obama became the president, she would have moved from the village and stayed a life that was different. But she remained with her people, empowered her people, and she had also several initiatives to support the community. So would want to celebrate her as a strong woman. And as we give our condolences, she's one of the women that has led by example, and I envy her, I admire her. And as we give the condolences, we wish that she rests in peace, and pray that we can have more stronger women who have made an impact in the society, not because of association, but also because of the things they did, the impact they had with the society or the people they lived with.
And Honorable Sifuna, your memories about Mamasara?
Yeah, I think I will join Honorable Sabina and the rest of the country in mourning the passing of the family matriarch of the Obamas. I think the phrase that was used by my party leader was that she was a symbol of resilience, that indeed even after the passing of her husband, she kept the family home going, did what was required to be done, and ensured that she kept the home going. So to the Obama family, to the people of Kogelo and in Siaya in general, I also want to take this opportunity to pass my condolences. We will remember her work in empowering and educating young women and girls. And we hope that in our small ways we can continue with the work that she was doing down there, so that it doesn't dissipate with her departure. May her soul rest in peace as well.
All right, and Dr. Chris Omalo?
Yeah, thank you very much. Before that, allow me also to send a message of condolence to one Bishop Nathan Chesang. Bishop Nathan Chesang comes from Trans Nzoia County. He passed on and is being buried this Friday. So I want to take this opportunity on my behalf of my family, to send my message of condolence to the Chang family. This is a bishop who was a peacemaker in Trans Nzoia County. He was very humble, and we pray to Almighty God to give his family strength and comfort at this difficult time. Now back to the Obamas. May I also, on behalf of the great people of our community constituency and Trans Nzoia County at large, send a message of condolence to the Obama family for the passing on of Mamasara. I remember Mamasara as a humble woman a woman who never went to school, but she was busy advocating for the girl child in terms of education. In fact, what she said that if a woman gets an education, she will not only educate her family, but she will educate the entire village. You know, particularly coming from somebody who didn't have a formal education. It's very, very encouraging. Mamasara Obama was very charismatic. She was one lady, very jovial, you know, and she remained humble, notwithstanding the fame of the grandson. And remember, the Obamas, it's a polygamy family. And in many polygamous families, we see a lot of divisions. But this lady managed to unite the family. She was a team player. She was a unifying factor.
Right.
So we request other Kenyans to emulate Mamasara Obama. And may the Almighty God give the family and friends strength and comfort at this difficult time.
All right, you know, you see the several stories on the different dailies, including on the Standard. Page 3, Michelle Obama, I felt safe and confident while in her presence. So the former First Lady of the U.S. told this story in her memoir, Becoming. Then you'll see President Obama, Granny served as a bridge to the past, and her stories helped fill a void in my heart. Of course, the stories of the journeys, the several trips that Barack Obama made to Kenya, including in 1987, the first time that he was here, and the person to welcome him was the only grandparent that was at the home at that time. Honorable Caleb Kositanyi, your thoughts on the passing on of Mamasara Obama?
Well, thank you, Sam. On behalf of the people of Soy constituency, who I represent, and the larger Uasin Gishu County, we'd like to pass our condolences to the family of the Obamas for the passing on of Mamasara. Mamasara reminds me of my maternal grandmother, who I saw when I was a young person, and my own mother. People who never went to school, but they gave a lot to society. They meant a lot in society. They actually performed duties that would have been performed by other people in a different way, in a way that touched many lives. I saw yesterday on this on Citizen TV a lady who said Mrs. Obama really educated all her children. Sarah Obama educated all her children, and used to call her and say, "Come, do not. There's food here. Come and let's share what the little that we have." So I think we need to emulate that, and to tell Kenyans to learn from Mamasara Obama. However successful you are, no matter what success you are associated with, always give back to society, especially the grassroots where you grew up. So we really mourn with the family, and we'll ask the Lord to rest her soul in eternal peace.
All right. And how Sarah Obama's kindness transformed her Kogelo village is the story on page 4 of the Standard. And thanks to former U.S. President Obama's grandmother, her village got a police station, had a key road tarmacked, and many vulnerable children and widows were supported. I've been there, and you will see the transformation compared to the old pictures that you would see of Kogelo. So our condolences, our thoughts and prayers with the family as they go ahead to lay her to rest in Kogelo later this morning. And now to transition to another topic that is becoming a bother in the country, and that is to do with the state of COVID-19 in the country. We understand that now there are 131,116 infections so far reported. Of these, 2,135 have died. And we understand that 1,270 patients are admitted in hospitals, 137 of them in ICU, a majority of them needing supplemental oxygen, some of them under ventilatory support. But you also know that 4,620 patients are doing what is called home-based care, meaning that they are isolating themselves in their homes. But there is also a vaccination drive. So we want to take a look at where we are as a country in this fight. And yesterday, there's something that came up. We understand that now we have a shortage in oxygen supply in the country. And I don't know, Honorable Sabina Shega, because you're the chairperson of the National Assembly Health Committee, are these things that we knew when we were setting out into this pandemic? Is this some information that has come before your committee of these challenges that you're facing in the fight against the virus?
I would say yes. Some of these things we discussed them earlier, and like the issues of ICU, of course ICU comes with oxygen and other things that are required. And there was a proper strategy laid out by the national government in conjunction with the county government. But what happened after the curve went a little bit down, it seems that people dropped the guns, including the facilities. Some of the hospitals even started renovation, and others were not well prepared when we're hit by the third wave. That's what I would say. But the national government, that is through the Ministry of Health, have been working closely with the governors. It's hard to really monitor what happens within the counties because I'm not really directly under the, I don't oversight counties, and the Senate does. But I would say some counties have done very well. I would like to name a county like Mombasa, a county like Makueni. They have really done well. And some counties are lagging behind. And in the implementation of universal, the UHC, something as simple as giving the names of the indigents, and counties were supposed to be given numbers. We still have counties still today that are still delaying the process because they have not given their names. It's really very sad where the government has we have put money aside. We had a challenge even at the supplementary budget to allocate that money because we allocated the money, the president launched the program, but we still have counties that have not given their names. And we were asking NHIF, why don't you then cover the ones that have been have already submitted their names? But because of the policy and the way the insurance works, they needed to launch all of them together. So I think the counties need to pull up their socks, and the MCs need to really check what their governors are doing, what their CECs health are doing. And I'm very sure if we are able to work and make sure that the health services are working at the counties level, because the national level, we only have level 6 referrals. By the time you're referring, we need to make sure that our dispensaries, and the government has put a lot of money, our other levels from level 2, 3, and 4, and to level 5, they are all working. So the big challenge is how the counties are managing health. There was a big suggestion when there was on the BBI about having the Health Service Commission. There have been challenges of the human resource, the number of the health workers that we have. There were some that were hired initially. The government had a plan for 6 months. So now that we are beyond the 6 months, are we still going to pay also to hire the extra staff members or the human resource that is required at this time? So proper management, proper planning is required. And, the proper coordination between the national, because the national government comes with the policy, but the real implementers are the county level. Some of these data, we have them. And the delay, like of what we have had on UHC, we have the labor, and, the labor ministry has all these data. So we don't need to reinvent the wheel. And we need to make sure that we take care of Kenyans, because a lot of money, and I would say a lot of money has been put in the health. It's not just about money, but it's a proper planning, strategy, and implementation. Yes.
And I want us to listen to what the Cabinet Secretary said yesterday as far as the oxygen crisis, so that you understand where we are.
And we are appealing to anybody who is holding oxygen cylinders to immediately return them so that the companies can be able to use them to supply oxygen to our hospitals. And these cylinders are expensive. The international market is obviously very squeezed now, and supply is a problem. Each cylinder costs about 40,000 shillings, and therefore you can do the maths. The cylinders out there, to replace them would require a substantial amount of money. So we are requesting, and we are asking for assistance, even from the government, GAO, to at least identify. And by the way, it is an offense to keep the cylinders when we have asked for them under the Public Health Act.
All right, so that's the Cabinet Secretary. And let me start with you, Dr. Wamalwa. Because this reality that we don't have sufficient supply of oxygen, the Cabinet Secretary is blaming it on the cylinders that we have. We had some statements last evening of some of the stakeholders in the industry saying that the bigger problem is on the piping and how we handle the oxygen that we have. I mean, a year into the pandemic, what did we miss along the way?
First and foremost, I want to say I was actually really embarrassed as a Kenyan, hearing Mutahi Kagwe, what he was saying. When you talk about the issues of oxygen, oxygen is something basic that should be available in a health setup. And when you start talking about the issue of cylinders, in fact, it's outdated. By now, we expect the hospitals to have been modernized. We have the issues of piping. And these issues of cylinders is only happening in government hospitals. When you go to the private sector hospitals, I think they've tried to modernize, and you can see piping is the order of the day. If you've done piping, you don't need, in fact, a lot of those cylinders. Once you have a cylinder, it can supply about 10 or so patients. So it's the highest time the minister should wake up. She should wake up so that they can be able to give funds so that we can have this modernization. And again, on this issue, Sam, on this issue of the COVID, the county government is the first line of defense. And when His Excellency the President brought in this issue of lockdown, it's unfortunate that he had set up precedents whereby initially he had cushioned Kenyans. But this time we don't have any strategies to cushion the Kenyans. The positivity rate at that time was even less than 10%. We're talking of positivity rate of almost 27% as we speak right now. I think yesterday night I had it was 26.6%.
Right.
This is a very high percentage if you compare with the WHO recommendations. So I think I expect His Excellency the President to come up with some cushion strategies to cushion the common mwananchi. And many Kenyans are going to lose their businesses, they're going to lose employment. So how are they going to survive? So this is some, you know, I remember my physics. There's a third motion, law of motion, Newton's law, where it says reaction and action are equal and in the opposite direction. So as you try to help Kenyans, look at their welfare. I want to thank the governor of Machakos. At least he's come up quickly and he has put some strategies in place to cushion the Kenyans. So we expect other county governments to follow suit, because county government is the first line of defense. When I go back to my county of Trans Nzoia, I don't know what Governor Kayemba has done. I had the chair of health committee talking about counties. I don't know whether Trans Nzoia has given in anything, because we are used to being backwards. I'm hoping this time when it comes to healthcare matters, we are looking at our governor. Because it's the first line of defense. We want to see what measures has he put in place, particularly to cushion the business people. We are seeing borders in my area. They're paying so much money. We are seeing the bars have been closed and they're still being taxed. We expect to see government suspend those taxes.
We'll get back to the containment measures. But first of all, I want us to finish up with this conversation around the state of COVID-19, because the infections are on the rise. Then you hear that the resources that we have are strained, whether it's the supply of oxygen or the ICU. And the question I'm asking is that, because yes, he says it's embarrassing, but is it truly a question of forward thinking on the side of the government, or is it that a selfish culture of people holding on the gas cylinders that they would have?
I think I share in the embarrassment of my brother. If you have been in a situation as long as the world has been in when it comes to COVID, nothing should catch you by surprise, really, because everything now about this pandemic is known. And as Chris Wamalwa says, one of the things that we learned very early on is that oxygen is going to be a critical factor in the management of COVID complications. Two things that are worrying from that story. The first one is that they're telling us that oxygen plants and concentrators in many of the government hospitals are in a state of disrepair. I mean, that is something that is inexcusable. Even before you come to, moving around people's homes looking for those who are holding on to those cylinders. It is extremely embarrassing that a year down the line we can still talk of unpreparedness when it comes to some of these things. The second thing to note is that in fact the price of the oxygen cylinders are affected highly by taxes. You can see that there is advice here from the Medical Engineering of Kenya Association, SG. She's saying that the government should regulate the pricing of oxygen and, if possible, waive duty on equipment. At a time when we know that this equipment is necessary and that it is required in great quantities, I think in order to help fight the pandemic, it only makes sense that members of parliament here, and I'm happy to have 3 of them, should look at the taxation regime, Chris. Some of the interventionist measures that you talk about were largely processed through Parliament last time out. We would like for you to go back. I know you have a session today, although the agenda might be different, but we expect that as our representatives, you will come out very strongly to demand that just like they have, government has implemented the same lockdown measures that we saw in the first wave, then the commensurate safety measures should also be put in place. Let them look at reviewing the VAT back to where it was during the first wave. Let them consider 14%. People who are still in employment to go back to the same tax brackets that we saw when it comes to PE and all other interventionist measures that had been put in place. Somebody was comparing us to what other congresses or parliaments have done in the world, and I know Chris Omalo knows that the US Congress passed a COVID relief that essentially sent almost over 100,000 shillings to each American to just cope with the current difficult situation. So we want to see those interventionist measures that can actually try and assuage the situation as it is right now. I know on social media these days everything is correlated with BBI, so I am happy that this time around, because reggae is on pause and it is in Parliament, nobody will say that we don't have cylinders because of BBI.
Okay. Of course, unfortunately, we don't have a medical expert on the panel who would guide us on how much oxygen is required by a patient who is in ICU 24 hours every day. But Caleb Kositanyi, so with the numbers that we are seeing, I saw a report sometime last week that was showing some of the counties that have reported a spike in infections for the past 2 to 6 weeks, and Uasin Gishu was one of those. I believe the spike was for the past 3 weeks. How much of concern is there, and do you think the precautions that have been taken at the national government is trickling down to those areas, and how safe are the residents in your county?
Well, Sam, I think we are in a very bad state and scary state as a nation. As earlier been said by one of the panelists, I think it was Chris, that the lockdown has come, but without any guidelines on exactly what government is doing to stop the spread and of more infections. All counties are actually affected, and all Kenyans are suffering. But the most important thing that we need to address is really, even as we lock down, what does a lockdown come with? Lockdown comes with the loss of jobs. Lockdown comes with the loss of income. We have, I think, I believe maybe 70% of Kenyans live on their daily wages, what they make on that particular day. So here you have locked down Nairobi. People cannot trade between Nairobi and Machakos and Thika and the other sides. And we have not given them incentives for them to stay at home, for them to be able to survive. So I think the Machakos governor needs to be recognized for what little effort that he has done. But the national government should, and I think today part of our discussion in Parliament today will be tax relief for Kenyans. We need to cushion Kenyans, especially those in the hotel industry. The tourism industry was picking up. Yesterday, I just did my own sampling within Nairobi, going into a restaurant, and you find that you are being told to serve takeaway. In fact, you don't even feel, we're these people who are kind of feel like we should eat with others and all. So it's actually very difficult. We need to find a way whereby government will put in money and cushion Kenyans who are at home. And I want to say this on the issue of oxygen and all. We've seen a lot of effort, government putting a lot of effort on many projects. The way those Sifuna is trying to avoid, to put us over, we don't line this with BBI. A lot of effort was put in BBI, a lot of government pressure, a lot of activity. Even the Nairobi Metropolitan Services, there's a lot of government effort, a lot of money being pumped in. That money should now be cut off. It should be pumped into ensuring that we have enough oxygen tanks, we have enough piping, modernize our hospitals so that we have the huge oxygen tank and a pipe to all beds in the hospital, so that we cushion Kenyans from this pandemic. I think we really need to, the lockdown is not enough. We want government to tell us now, during the lockdown, this is what we are doing, this is the money that we've put in place for this. and so that we can actually be able to contain this pandemic.
And talking about containment measures and the lockdown that the country is experiencing, though in partial form, let's listen to what Kenya leader Martha Karua spoke about yesterday, commenting about the measures that were announced by the president on Friday last week.
Immediately take up the cost of testing and treatment of COVID-19 in all government facilities countrywide. 2, intensify testing and vaccination in the areas designated as disease-infected zones. That is the 5 counties, to ensure a return to normalcy at the earliest opportunity. The government must take immediate steps to enhance capacity in all county hospitals for testing and response to the critically ill, including the management of the daily health needs of Kenyans.
Right, that is Honorable Martha Karua, but there's also some people who work in certain sectors, especially the hospitality and food sector, who've been commenting about what just happened. Let's listen to some of them as they recount the effects of this partial lockdown.
Rais ali-announce on Saturday, ndio sasa barua tukapata jana ya kwamba management haiwezi to reserve hapa kwa sababu sasa kazi yetu ni kama imekuwa chini, hakuna wateja kwa kampuni. Wenye tulikuwa tunategemea ni hao international tourists na local tourists, hivi kwamba wengine wamekuwa lockdown, hawawezi fika mahali hapa. Pata tu namna ya kwenda nyumbani, itabidi tu niende nyumbani juu sasa hakuna vile nafanya kazi, siwezi kaa kwa kampuni, sina income yoyote nategemea, kwa sababu tena familia ikiwa nyumbani na mimi niko Nairobi, wanafikiria mimi niko kazi, ili hali siko kazi.
Mimi natokea kule maeneo ya magharibi mwa Kenya. Hata sasa hivi tunavyozungumza, sijui nitafika vipi nyumbani, sijui itakuwaje, kwa sababu management imesema haiwezi accommodate kwa sababu hakuna income. Hapa tumeambiwa tunaenda nyumbani mpaka vitu vikuje viwe tena sawa. Manake kuangazia ile speech ya rais, alisema until further notice. Sasa that further notice ndio hatujui ni lini vitu zitakuja zireje ziwe sawa.
And Honorable Sabina Chege, you're the chair of the health committee, so you might have more information than all of us, probably even combined. But when a decision is made upon consultation with the different organs of the state, and this impact is felt immediately, did we think about cushioning Kenyans and the sort of impact that already is being experienced in parts of Machakos, Nakuru, Kajiado, Kiambu, and Nairobi?
Well, what I think is that this time when we're doing the cessation of movement and the new protocols that we gave, we missed somewhere. I think we missed something. Because last time, as I said, by the time we were doing the cessation of movement, we had plans to cushion Kenyans. The issues of taxation that have come up, the issues on the social support were clear. And with the experience, as Caleb has said, now it's almost 1 year down the line. We must have learned something. You know, when COVID came, could have taken excuses because then it was new. We didn't know what the rest of the world were doing. But right now, we have various places to benchmark. Though we are facing hard economic times, and maybe the government was not willing to fully commit, but there are some things that should have come first. The issues of testing, the other nations are even doing the rapid testing, so you don't have to do the length one, so that then if we test, then we can allow the people who are negative to actually serve in hotels. The issues of vaccination, it's okay. The government said that they'll consider next the people who are from the age of 58. But if you think about it, the elderly might not leave the house. Majority of them are not leaving their homes. But we have people who are serving us in the supermarkets every day. You know, we have people who are working in the banks every day interacting. So even if you have locked down, I think as we looked at the front line, and even to cushion Kenyans, the people in the matatus, because Kenyans are still using matatus, the people in the hospitality industry, I think we would have done a better approach. When I saw the ministry of tourism and people saying, hey, we have tourists who are already in the Mara or other regions, what do? We had bookings. Did we think ahead? Did we actually consult and say, So what's the way forward? And I saw Kenyans genuinely complaining last night, saying, how do we then say we have local flights for international, for tourists and not for Kenyans? Then have we locked down ourselves, but we're allowing others who are coming out from our boundaries to actually come, and they can be able to have services or access to services. So I think the approach was not the best. We have a chance as Parliament to sit down, and I've seen there's even a bill proposed by Honorable Sakaja on how to to manage pandemics, and I think this was much more of a knee-jerk reaction. And we need to consult further. It's now 3-4 days down the road. So what do we do as Parliament? Even closing Parliament, we have several important bills. Would we then have resorted back to the way we did the social distancing in Parliament instead of just saying go home? Because we have several very important bills that have delayed. So yes, some of our colleagues have gotten COVID like any other, like we have had people in the church. And we know people have tried to put measures.
Right.
Would we have then relooked at the whole approach? I think we still need to have this open conversation. It is sad when we're talking about, yes, the oxygen cylinders and the cost, but we knew we want to use oxygen. We needed oxygen. So is it that we have just discovered?
And that is where the question comes. What is the disconnect between, because, I mean, Parliament is supposed to oversight the executive and also to give them money when they need. So what is that disconnect that nobody is able to see and think looking forward?
It's difficult sometimes to really get to know where the disconnect is. But we have, the ministry is in charge of policy, and once it comes to come up with the policy, then the policies are supposed to be implemented by specific agents, be it the county government or even the Ministry of Public Health or any other agent. I think the follow-up, because out of my experience, when we went around to just say we allocated money, you remember Parliament was generous even to give the 3 billion that was supposed to be used at Parliament to specific counties. When we went down to check what happened with that money, we found some counties, some of them chose to divert the money to other things, not really for COVID. Others had started, and halfway down the lane, they were like, we bought 10 ventilators, they were never used to. It was almost, they were put somewhere in a store. And so it's like this third wave was not expected. But we have experts. We have people within the Ministry of Health who are able to follow what's happening across the world. I'll say this pandemic has affected not only Kenya but many other countries. But how we handle it, how we'll come out of it, that is what matters. But I think planning and people sitting together, consulting. We had the national, the pandemic team that was there before. Where is the team now? Are they still meeting? Or did we just disband the team? We need more consultation. When we need people to really consult and come up with the best way forward, so that we are able to caution Kenyans.
SG Sifuna, what are your thoughts about this partial lockdown and the impact it's already having on the people?
I think, Sam, I will disagree with my sister respectfully that Kenyans at this moment are tired of consultations and stories and so on and so forth. I mean, by now we should have gotten a handle on this pandemic. Even if you don't have any original ideas of yourself, so you copy what other people are doing in the rest of the world. Because right now, the focus should just be on cushioning people from the effects, especially the economic effects, and ramping up vaccination. I mean, if every available resource should be channeled towards ensuring that we are able to very quickly vaccinate the population so that we are able to get back to our normal lives. I mean, and when we talk about cushioning, for us as ODM, I remember when IPRA announced the new oil prices, and we put out a statement to say that that is something that is nothing short of diabolic, especially when we're going into the planting season and then the price of diesel goes up, and yet we are expected to have a good harvest so that we can also cushion people at a time when we are singing food security and all these other things. So we didn't just stop there. I'm very happy that the Speaker of the National Assembly actually allowed a probe by the joint committees of energy and delegated legislation into the pricing mechanism of IPRA. And that was as a result of our Member of Parliament from Vita, Honorable Abdul Swamad, taking this issue now to the floor of Parliament. I want to challenge the leaders who are here and who are in Parliament, that indeed it is quite heartbreaking when those of us who are not in Parliament see the sort of helplessness that we see in Parliament. Mheshimiwa Chege, when you say those things that you don't even know where the disconnect is, as an ordinary Kenyan, sometimes we get very disillusioned because we are looking at the leadership, especially in Parliament, for us to be able to find solutions to this problem. I am ready to say even here that because I know Mheshimiwa Kositani was trying to make reference to the issue of BBI. I know for a fact that there is no money that is spent on BBI. But if there is a single shilling that was going into BBI, can we now use it to buy vaccines? Because I know there is no money there. But I'm just saying that right now we should be focusing on making sure that if the president, for instance, had announced these measures and said that we are going to ensure that we have, by the time we reopen or by the next time that I address the country, that all of us are vaccinated, so that we can be able to go back to our lives and fend for ourselves. For the longest time, Kenyans have gotten used to never looking up to government for solutions. But we also do not want government to now impede our ability to fend for ourselves. That's why we are saying focus on measures that can assuage the economic situation. I mean, we know these people. We have these friends. I know the restaurant that Caleb Kositani is talking about because we run into each other from time to time. The management, the waitresses there, the people who work there are our friends. You go there and they ask you, Mheshimiwa, is there now some place like, can I come and sweep your office? I mean, and you can see the desperation on people's faces. They would like businesses to be open, to continue, and the singular focus, just like other countries are doing. If you don't have original ideas, just copy what the other countries are doing. Focus on getting people support and focus on ensuring that you ramp up vaccination so that in the shortest period possible, you can have a return to normalcy.
And so, Honorable Wamanda, because the three of you sit in Parliament, so we cannot sit here and just complain and whine, but what solutions are we likely to see moving forward? Because it's clear that whatever decision was made and announced by the president is having negative impacts and is likely to do so even moving forward. You've seen the statement from the Kenya Tourism Federation indicating that 1.3 million jobs would be at risk and asking for some relaxation of the measures, including having domestic tourists travel as long as they have a COVID-19 negative certificate. So what shall we see Parliament doing to help its people?
First of all, I want to say that Parliament represents people. The Constitution is very clear. Parliament is there to deliberate and resolve any issue of importance to the people. Parliament cannot be directed by the executive. In fact, as we go to Parliament today, if I remember the President's sentiments that he requests Parliament, I think, in concurrence so that we can suspend the sittings. To me, if we suspend the sittings, that is going to be more chaotic because Parliament must be there to deliberate on issues and resolve issues that affect the people. So when we get back today, I think we're going to deliberate. I don't want to maybe try to say what is likely to happen because Parliament, a majority have their way. Minority have their say, but majority have their way. So when we go debate this afternoon, for me, I'm not so sure whether Parliament is going to suspend. Maybe it's going to look at their calendar and see whether the sittings will remain twice per week or once per week. But closing Parliament to me is disaster. So Parliament's responsibility is to legislate. Last week, 2 weeks ago, when this matter came to the floor of the House, I'm among the MPs who objected because we were like, we are seeing the positivity rates are still going up, but we are seeing the tax measures, for example, the VAT. When this issue came under, I think, the Committee on Devolution, which came as a regulation, because VAT is under the regulation. So some of us, we opposed this issue of moving back from 14 to 16%, because the corona cases, we were looking at the positivity rate, was still rising. So what was the logic behind this issue of going back to the 16%? Because you're not be cushioning the common mwananchi. Others argued that maybe the benefits are not going to the consumer. We have some unscrupulous business people who are the ones who are getting the benefit. But we thought the government should have put measures in place to ensure that this relief of moving from 16 to 14% must be ensured so that the common consumer benefits. Coming to the issues of fuel, when you look at the fuel prices have gone up, and when you increase the price of fuel, it cuts across the industry. We'll have issues of inflation. And when you do the computation, you'll find that almost 50, even 60% of the fuel prices in form of taxes and levies. So why should the government not come in and try to lower these levies, these taxations, so that first we lower the price of fuel, and this will help the industry in terms of cushioning, because fuel cuts across the industry, whether it's in manufacturing, whether it's in transportation, and what have you. Secondly, the issue of the lower bracket, they were given tax relief. People who are earning 24,000 and less, they were not subjected to pay, but it was reversed. So I expected His Excellency, the President, that at a time like this, please, let's go back. And there was the issue of 30% corporate tax. This was specifically for the business people, so that their taxation is minimized,
right,
so that they remain afloat, so that the employees will not be sent home. Because if you expect to pay your employees by end of the month, and there's no income coming, where are you going to get the money to pay your employees?
Right.
So that 30% corporation tax was actually helping to cushion these small farms, so
right,
that they don't close down,
okay,
to ensure the people from Kibera, the people from Madare, wherever they come from, that they still have employment. Coming to the churches, I don't know whether you saw the clip from a reverend pastor from Kahawa Pefa. No, the Interfaith Council is there. We need to be told, why were churches closed? Because when you do contact tracing, and I'll tell you this, because at a time like this, when we have stress, we have frustrations, people run to the church. I expected a study to have been done, so that to be told that these infections are coming as a result of the churches.
But Dr. Chris Omalo...
But now, let me finish, I've not finished. Let me just finish for a second.
Just a moment. Over a period of time, we had seen reports of churches, not all of them, but certain churches that were floating the COVID-19 regulations. So was there a better way of handling the different churches based on how they're observing the COVID-19 regulations?
I go to church, and the churches have been going. They've been following the protocols. You must sanitize first. When you go in the social distance, some of them is not even 1.5, it's 2 to 3 meters. So in my mind, I'm very sure that these infections are not coming as a result of churches.
But there are those that are flouting.
Maybe political rallies. If any church was found going against the protocols,
okay,
then that church should be closed. But because I did some sampling, and the churches have gone through, they've been observing social distance. And in times of stress, when you read the Bible, I think it's Matthew 11:28, the Bible says, come to me, all of you have burdened. You go to church for spiritual nourishment. So I'm humbly requesting His Excellency, the President, to revisit the issue of churches. Even if it means having 50% capacity of the churches, please, let's go back so that the churches can be reopened. I'm not saying this because some people are joking on the social media that the church is because it's complaining of Sadaka. I don't think it's Sadaka. There's a bigger picture that the church plays. There's this issue of counseling. Okay. At a time like this, people are stressed. We go back to the church again.
Not just the churches have been shut down, it's also all places of worship.
In the lockdown areas.
All places of worship in the 5 counties.
Yeah, absolutely.
I want to bring in Honorable Caleb Kositany, because when the last time the lockdown was announced for the entire country, there were all those measures, whether you call them the tax measures or the incentives to businesses and vulnerable people that were announced, including the corporate tax was reduced from 30% to 25%. The maximum pay tax was reduced from 30% to 25%. The VAT was reduced from 16% to 14%. But all that came back in January of this year, of course, after the approval of Parliament, meaning that they also participated in amending that law. But are we at a time that the government can actually afford to extend all these incentives, or are we so broke to even afford such kind of a discussion?
Well, that's a very tough question, Sam. Are we broke? I think, yes, we have been told by none other than our CS Treasury that we're not doing so well as a nation in terms of finances. But Sam, I think, as Edwin Sifuna has clearly said there, that even if we don't have an original idea of our own, we should then be able to copy, paste what others are doing. This second lockdown, I think, was done very casually. Very, very casually. First of all, the president comes and reads and says he has locked down the country from midnight. And then immediately after he has finished reading his statement, there is a statement the interior. Okay, no, ignore that statement by the president. You can travel until Monday. Airlines can travel until Monday. Those who are out of town, I think the government spokesman says you have until Sunday to come back. A lot of corrections were done to that statement. We tells you that there are people within the president's office that are handling presidential matters, national matters, very, very, very casually. And I expect that by now, some heads should have rolled, because the president should have announced the lockdown, given time to people who are even travel to Mombasa for holiday, travel to the Masai Mara, and all these things that we are seeing now. Actually, the entire statement by the president should actually be redone again, so that we have containment measures. And as you have clearly put it, Parliament passed the law to revert to the old tax regime. I think today, part of the agenda should be we should revert to cushioning Kenyans from this hardship. And at the time when we were cushioning Kenyans in the first lockdown, the prices of fuel were still quite friendly. Right now we have seen an increase of about 17 shillings per litre on the price of fuel. So I think we really need, as Parliament, to continue with our sittings. If it is possible, we will debate, and I think all members of Parliament will be present today, because it's actually important that Parliament continues. As we observe the COVID regulations, we continue so that we can always be able to legislate and give guidance on this matter. Because what has come out clearly is that Parliament now, as another arm of government, needs to play its active role, because the executive seems to be having problems in coordinating what exactly is supposed to be done.
Well, the question of coordination you say there, but I want us to exit from this conversation, but not without talking about what people are saying could be the solution to dealing with COVID-19, or it was actually called a new weapon in this. And that is the question about vaccination. Honorable Sabina, you sit at the, again, National Assembly Health Committee, and there's a question I've been asking without an answer about the expiry of vaccines, because you're told that it has a shelf life of 6 months, but do we know the manufacturing date of that vaccine so that we can see for how long we can use it? And then secondly, is there any plan in government to procure vaccines for the population, or we're just depending on donations?
From our meeting last week, and we're going to have a meeting this morning with the Ministry of Health, the vaccine expiring date should be in the next 4 months, because it's meant to be there for 6 months, and we've had it for the last 2 months here in the country. So we can confidently say we have 4 months to go. The uptake of the vaccine, or the vaccine that we had, was from Gavi, which was fully donation. And from last week's meeting, we're expecting more. So we had slightly over 1 million. So they were expecting to have by last week 3 million. I didn't hear of any vaccine coming in. One of the questions that we raised when they brought in the budget, because the ministry brings in the budget for us to go through, was that vaccine was not part of what was covered. And they said they have donations that are coming up. There was a suggestion that we might need to buy extra with a cost of around 4 billion, but also depends on which vaccine, because right now the one that we have is what we have gotten from Gavi. And so the uptake of the vaccine also has been a big challenge, where by yesterday it was around 90,000 out of 500,000 by last week that had already been released. And I think the biggest challenge has been on the communication. Yesterday there was proper communication from the ministry of every county and where you can receive the vaccine, which was a very good thing, because last time we met with them, people didn't even know where to go and get vaccinated. And I think various institutions, the priority was given then to the health, the frontline health workers, to the teachers. And out of my experience, interaction with my teachers, even within my counties, they were not sure on where to go and get the vaccine. And of course, a lot of issues also came up, the issues on the safety of vaccine. There was a lot happening, and they said within the internet. I think it was good for the president and also the cabinet secretary of health. There were questions why they had not received the vaccine. And so I think the big boost when they received the vaccine, now you can see many Kenyans are actually going to get the vaccine. So a bigger plan is for us as we are budgeting to make sure that we also budget for our own. But as I've said, apart from now the elderly, the 58, we need to focus on the matatus, the people in hospitality industry, and I think we can be able to really cushion. Though getting the vaccine doesn't mean that you can't get infected, but your body will be better in place to fight. So it is important. The police also are supposed to be the front line.
On the priority list.
Yeah, but,
but you see, even for the communication, that's what I say. If the ministry says, then we are giving priorities to the teachers. And then we have TSC, we have Ministry of Education to even give timelines of the teachers that you have to be vaccinated by this time, although it also came as voluntary and you can't really force. Also the same thing with the police, the same thing with the frontline health workers, because they were also doctors and nurses. And I think I've seen Honorable Amano, we are both Catholic, some of the Catholic doctors coming out strongly against the vaccine. So there was those gray areas that were there, but I think proper communication is required. And I said by yesterday, there was clear communication of which facilities, both private, faith-based, the private ones, and the public facilities that you can get vaccinated. But the biggest, what Kenyans need to know, whether you go to a private facility or a faith-based or a public facility, that vaccine is free. And nobody should charge you for anything. There could be some service fee. There's no service fee. The other government
there's no service.
There's no service fee. It's supposed to be free.
Okay, all right. And
whether you go to a public facility or you go to a private facility.
SG Sifuna, I almost called you honorable. You need to become honorable.
I will soon, inshallah.
And I want us to exit from this because you don't sit in parliament. So, but what are your thoughts? What would you want to see? Because many sectors are asking for this vaccination drive, including the Kenya Tourism Federation, because the hospitality industry is getting affected by all these lockdowns. Yet, if they got a vaccine, they could be better to deal with it. If you look at the statistics, 68% of the infections are for people between the ages of 20 and 49. That's you and I. But then the vaccine is just for the frontline workers and the 58 and above. And the people above 58 account for less than, actually the people above 49 account for just about 10% of the infections. So what would you want to see going forward?
Yeah, I think, as I said earlier, the focus has to be on getting the largest number of people vaccinated in the shortest time possible. That has been the focus of all governments across the world. And you have seen in places where they are hitting almost 100 million vaccinations and so on and so forth, there is a gradual reopening. You can see the CDC in the US, for instance, relaxing these protocols for people who have received vaccines. You can go out in groups. You can go out in groups without masks. You can return to some semblance of normalcy. So I think that is where the focus has to be. It is quite disappointing that we rarely ever get anything right, even when it comes to something as basic as communication. And Caleb has alluded to some of it, that the confusion around the presidential communication is something that we have to call out. I mean, at that level, even for us as, and Chris is here as acting SG, he knows that when he releases a statement, there should be very little room for people to actually, question what you said or even the impact of what you said. So we would like to see a better effort in terms of the government in communication, including what the chair is referring to here. Just information on where the vaccine can be gotten is something that we get wrong somehow. It's like we are always looking for ways to stumble. It is quite amazing. I personally think that the president took too long with his team to get the vaccination going. I know that there was a reason behind prioritizing the frontline workers, but you saw even the reluctance of those frontline workers. People underestimate the value of these politicians in terms of convincing the public. People in Kimini would probably not get that vaccine if they have not seen Chris Omalo getting. Right. So there was probably some urgency in front-loading the political leadership to get the vaccine, so that people can get some semblance of confidence. I like something that Chris also said about the churches. I have also a very unpopular opinion on the blame on politicians. We should be making decisions based on data. Just like Chris is asking, where is the data to support the contention that churches need to be locked down because they are spreading COVID faster than any other institution or even other places of worship? I also don't see the data to support this contention that somehow politicians are to blame for the third wave. We had by-elections in Matungu, in Kabuchai. I would like to see the data in Kabuchai Why is Kabuchai not one of the places that has been locked down because of the political
but
activities?
Some politicians have tested positive.
Yes,
after political
in spite
events.
of, I'm painfully aware, I know you're going to send me to my party leader.
No,
but
it's
I'm just saying, we need data-driven decision making, so that just the way that Chris is arguing that in fact we need to see data to show that the places of worship are, a big problem. We have also seen inordinate blame, even from that same bishop, was it a pastor, from PEFA. He went straight from lamenting the closure of the churches to directly blaming the principals of the BBI, that they are the ones who have. I would like to see the data as well, so that we don't just blanket blame. This is something that has to be approached scientifically. So we are dealing with a disease. It is not something that is up for speculation. It is something that should be driven by data.
But it should appear we've been facing challenges on that front. But need to correct something here. I said that over 49 account for 9%, no, it's 21%. It's the people above 59 that account for less than 10%. And then that is percentage of infections. Then people that are below 20, these are basically those in the schools, both secondary and primary, they account for 9.9%. But all these institutions, the in-person learning has been suspended until further notice. We want to take a short break. When we return, we'll be diving into the final conversation, which is about the politics of the country, the future of this following the lockdown. We also know that there's that request to Parliament to suspend its sittings and committee sittings. Also, there's a directive from the President that cabinet in-person sittings will have to be suspended. So what will this mean? But also the question about the political alliances that are forming every single day.